So Dr. Singer, there's a statistic that's cited over and over again in the media that 80% of antibiotics are used in livestock production in the United States. Is that an accurate statistic?
Well, this is a really confusing and misleading number. We don't have good estimates for how much antibiotic is used in animal agriculture or in human medicine. And so what we have done, those who have tried to come up with these numbers, is they will gravitate towards data wherever it might exist. On the veterinary side, often that is sales data. How much total antibiotic of each type was sold in a given year. That doesn't distinguish which animal it got used in, for what purpose, and it lumps all antibiotics together as if they are all equally comparable with respect to resistance. On the human side, they tend to work with estimates of how much illness might you see in a given hospital and which antibiotics are likely to be prescribed for that illness. So we, on both ends, on the animal side and on the human side, have very rough, misleading estimates of how much antibiotic is used. And then those get compared for how much total is used in animals versus humans.
Well, would it make sense that we would give livestock more antibiotics given their size?
On an individual basis, it depends on the animal we're talking about. If you compare a cow and a human, so you're comparing a ruminant to an omnivore, the ruminant has a very different metabolism. The animal is very much larger than a human, and so for a given disease, if you were to give the exact same antibiotic, you probably are going to give much more. But I think one of the biggest problems of using a number like this 80% is that it includes antibiotics that have no relevance to human health and that have no evidence of even being a problem for antibiotic resistance. Specifically, I'm talking about the ionophores. What happens is if you take the ionophore usage and let's say tetracycline usage in agriculture animal populations, you have over 70% of the animal usage right there in those two classes. That accounts for less than 10% of the human total usage. If you look at the critically important antibiotics to humans that would comprise over 70% of that usage for human populations, for the animal side that comprises less than 10% of the animal antibiotic use.
I think consumers are confused because they see antibiotic-free and organic options in the marketplace and they're wondering if those producers can produce these animals without antibiotics, why can't everybody?
On a comparison of organic and antibiotic-free, what the consumer needs to know is that if they believe that that is a health benefit for them, then they are welcome to make that choice. But they should understand that animals, just like people, get sick. And that includes animals raised in organic and antibiotic-free settings. When an animal gets sick, it should be treated, usually with an antibiotic if an antibiotic is warranted for the bacterial infection. It's part of the veterinarian's oath, which is to protect animal health and welfare. So this animal now gets sick in an organic or antibiotic-free stream. Once that animal is treated, it can no longer be marketed as organic or antibiotic-free. We need the conventional stream, those animals raised with antibiotics, as a means for still being able to consume perfectly wholesome meat from an animal that was treated with antibiotic.